A brain tumor diagnosis can be terrifying and devastating. But what if catching it early could save your life? There are key signs your body gives that may indicate the presence of a concerning brain tumor. In this video, I'll share the 9 most critical warning signs to watch out for so you can get checked and treated as soon as possible. These are the subtle symptoms you absolutely cannot ignore. That could mean the difference between life and death if it is a brain tumor. Brain tumors are relatively uncommon, but they can be very serious and even life-threatening if not caught and treated early. That's why it's important to be aware of the signs and symptoms that may indicate the presence of a brain tumor. Here are 9 warning signs to watch out for. 1. Persistent headaches. Frequent headaches are very common, especially tension headaches and migraines. But a headache that persists day after day and doesn't respond to medication or other treatments could potentially be a red flag for a brain tumor. Headaches caused by brain tumors tend to be worse in the morning and ease during the day. They may seem to originate from a specific point in the head. The pain can range from dull and throbbing to sharp and piercing. Nausea and vomiting may accompany the headaches. If your headaches are unusual or concerning in any way, see your doctor. They can do imaging tests to check for any abnormalities in the brain. 2. Vision changes or loss of vision. Since the visual pathways in the brain are very delicate, any growth or tumor can press on and damage them. Vision changes are a common symptom of brain tumors. You may experience blurred or double vision, loss of peripheral vision, floaters, flashes of light, or sudden loss of vision in one or both eyes. Pituitary tumors at the base of the brain can cause vision loss by pressing on the optic nerves. So can tumors in the occipital lobe at the back of the brain, which controls vision. See an ophthalmologist right away if you have any unexplained vision issues. 3. Nausea and vomiting. Nausea and vomiting along with headaches can signal increased pressure inside the skull due to a growing tumor. The medical name for this is intracranial pressure. If a tumor is obstructing the flow of cerebrospinal fluid in the brain, the fluid can build up causing nausea, headaches, and vomiting. These symptoms tend to be worse in the morning because fluids pool in the brain during sleep. Vomiting without nausea may be a sign of a posterior fossa tumor located in the back part of the brain near the brainstem. See a doctor if nausea and vomiting persist and aren't explained by viruses, food poisoning, or other causes. 4. Seizures, convulsions. Seizures or convulsions occur when abnormal electrical activity spreads through the brain. The seizures may involve noticeable jerking and trembling of the body and loss of consciousness. Or they can be subtler symptoms like staring spells, confusion, muscle spasms, or loss of awareness. Seizures are a common symptom of brain tumors because the abnormal growth can irritate surrounding brain tissue and trigger electrical misfires in the brain. Generalized seizures that cause loss of consciousness point to deeper brain structures as the possible location of a tumor. Seek immediate medical care if you have a seizure for the first time or seizures that are increasing. 5. Weakness on one side of the body. Unexplained weakness or numbness on one side of the body could stem from a brain tumor. This is often a sign of a tumor located in the frontal or parietal lobe of the brain that controls motor function and sensation. Weakness on one side of the body is often accompanied by lack of coordination, stumbling and dragging of the leg or arm on that side. The medical term for this is hemiparesis. It occurs because the tumor is pressing on the nerves that control those limbs. Weakness that comes and goes can indicate seizures as well. See a doctor right away if you experience any paralysis or weakness on one side. 6. Changes in personality and behavior. Tumors in the frontal lobe of the brain can affect the nerves involved in judgment, impulse control, problem solving, social behavior, and personality. Signs may include depression, irritability, or mood swings, confusion and memory loss, impulsivity and poor judgment, changes in social behavior, loss of interest in favorite activities. Brain tumors may also cause psychosis, delusions, hallucinations, and compulsive behaviors. Loved ones tend to notice personality and behavior changes well before the patient does. Seek medical evaluation if your personality undergoes significant changes for no clear reason. 7. Memory loss. We all experience occasional forgetfulness and foggy thinking. But persistent memory loss and confusion could result from a brain tumor putting pressure on areas involved with memory. Short-term memory problems, losing one's train of thought, and difficulty concentrating may occur. Long-term memory can also become hazy. Long-term. Inability to remember new information is common. Asking the same questions repeatedly or getting lost in familiar places can also signal trouble. See your doctor for any mental fuzziness, confusion, or disorientation that becomes progressive or worsens over time. 8. Difficulty speaking. Speech and communication difficulties point to possible brain tumors located in language centers of the brain. You may notice yourself having trouble getting words out, substituting words, or slurring speech. Speech may become garbled or nonsensical. Conditions like strokes, Bell's palsy, and multiple sclerosis can also affect speech, so brain tumors are not the only cause. But any difficulty speaking, making sense, or understanding others warrants a medical evaluation. Don't ignore changes in your ability to communicate. 9. Loss of balance and coordination. Balance problems, dizziness, vertigo, and lack of coordination can result from several types of brain tumors. Cerebellum tumors in the back part of the brain often cause balance and coordination issues. So do brainstem tumors, since the brainstem controls motor functions and coordination. You may feel unsteady on your feet, stumble frequently, have difficulty walking or standing, and lose coordination. See a doctor if you experience multiple falls, walking into things often, or clumsiness that wasn't previously an issue. Diagnostic tests can determine if a brain tumor could be contributing. Seek medical evaluation promptly for symptoms. The signs and symptoms covered here can occur due to causes other than brain tumors. But it's important to consult a doctor promptly if you notice any of these issues. Early detection of brain tumors can make a huge difference in treatment and prognosis. Diagnostic tools like CT scans, MRIs, and blood tests can pinpoint what's wrong. If tests reveal a brain tumor, getting treated quickly is vital. Treatment options like surgery, radiation, chemotherapy, and newer immunotherapies can remove or slow tumor growth and prevent serious complications depending on the type of tumor.